We're driving downtown, foot pushed on the pedal. Move to songs we play together. Feel like we're on holiday. I got a feeling it's a good day. We're driving downtown, foot pushed on the pedal. Move to songs we play together. Feel like we're on holiday. I got a feeling it's a good day.
Hi guys! Welcome back to my YouTube channel. This is me again, that's in Toys or Nurse Mark Shao. Again, to those who are new in my channel, my name is Mark. I'm a registered nurse here in UK, of course in the Philippines and Abu Dhabi. So, to those who are here because of the video I uploaded in Reels or in Facebook, thank you so much because it means that you want to know more about Arterial Line. This edition is a much more in-depth but not too serious. We're gonna do it in a lighter version, just for you to understand what is Arterial Line, whether you're a nurses or not, okay? Just a brief information about me as a nurse here in UK. I am a hemodialysis nurse, an A&E nurse, and of course an ICU nurse. My experience as ICU nurse, mostly from neuro, but now I'm in cardiac. It's still the same, but there's a bit difference in terms of routine, protocols, because again, neuro is the brain, cardiac is the heart. Obvious naman. Disclaimer, again, this is based on my overall knowledge, my experience, and own research. If I don't cover some other stuff regarding Arterial Line, it's just me picking up the much more easier, convenient, or easy to digest things regarding the topic I'm gonna share, okay? So let's begin. Let's start the vlog defining what is art line. By definition, art line is a thin catheter inserted into artery to monitor blood pressure and to take blood samples. Those two things mainly lang. There is different sizes for the needles. The one who's going to insert will choose what size would be preferable. Where is the insertion area? As you can see in the picture, there are multiple numbers of insertion area a doctor or a practitioner can choose from. But the most common area is the radial or the wrist. Why? Because it's more accurate. There's a general rule regarding it. The more further the arterial line is inserted in the body, the less accurate it is. They could also insert that sa legs. Again, the further away from the heart, the less accurate it is. Okay? Next, this is the example of an inserted arterial line. So sa wrist, where is it connected? Again, there's a line tubing connected to it, and then it is connected into a monitor. What is our role as a nurses during insertion time? Us nurses, like me, I'm the one preparing the things, most specifically the transducer. So what is transducer? This is the transducer. There are different kind of transducer that we use in ICU. The inside of that tubing is saline, or what we call, let's sabihin na natin tubing. So the inside of the line is filled with water. So ano ba ginagawa ng our transducer? It is the one that monitors the pressure. And the very tip of that needle yun na-insert sa skin. So it's very important part. There's also a pressure that stops the blood backflowing. Without it, mag-backflow yung blood. So that transducer monitors the pressure and also stop the backflow of the blood. Next would be monitor. This is the monitor that we use. This is not exactly the monitor that we use here in UK, but this is somehow a good presentation of the monitor that you will see in ICU or even in ward area that requires us to monitor blood pressure, heart rate, saturations, ECG or yung trace ng electrical tracing ng heart, and so on and so forth. Just for you not to get confused, the art line pressure or the blood pressure, real-time blood pressure of the patient is the one on the red. See, it's 49/45. The green one is the heart rate. It's 185, that's too much. The light blue one, which is 98, that's the oxygen saturation. And some other things like 106/75, that's a blood pressure, but that blood pressure is from the normal cuff. Yun nandito sa braso that we usually use. So again, the 49/35, the one that you will see there, is the real-time blood pressure of the patient coming from the arterial line. Okay? Next, what else can it do? So aside from blood pressure, I have mentioned we could take blood samples. What are the blood samples that can be taken? Everything. So whether if it's a routine blood samples, a special blood sample, we could take it from there. That is the picture of how we take it. It's not exactly how we do it. Here's another picture showing where we usually take the blood samples. That's that part yun. So we take it from there, making sure malinis, we cleaned it, we are using PPE, we're wearing gloves, and of course we're wearing apron because we don't want any splatter of blood, and of course we don't want any blood from our hands, right? At the same time, it's a protection for the patient, making sure we're not introducing or giving patient an infection. Okay, so that's the other use for the arterial line. Next would be safety checks. So safety checks, there are two safety checks that we do to make sure the arterial line is accurate. First, we have what we call zeroing. Zeroing, as in zero. What is arterial line zeroing? I mentioned about the transducer, right? This is the picture of that transducer. So that one should be in line with the patient chest or the heart. Paano ba yun? Here's the picture. That area is the transducer. The very most important part of the transducer. We make sure it's within the chest, in line with the chest, whether the patient is sit upright or lying down. Once we make sure that it's properly aligned, we're gonna go to the monitor, which is that monitor. We're gonna look for the zero. Once we click that, the monitor will calculate or will remove any atmospheric interference that may cause inaccurate blood pressure reading. And we do that once or twice per shift. Next would be square test. Square test is something that we do like a flush. Again, that transducer, we squeeze it, and once we squeeze it, it's gonna flash out fluid directly to the arterial line and it will just deliver fluid. But what we test there is the one that will show in the monitor. That is a picture of a square test. So as you can see, it's not totally a square like a square. Once we squeeze the transducer, the line will just jump up and then it will maintain up. But once you release it, should be a sudden drop. Once it drops, it will make an oscillating, just 1 to 2. That's how we know it's patent, it's an accurate reading. So that's the two check that we do to make sure your art line is patent and stress-free. Next, how long does it stay? Depending on the hospital protocol, the needle itself stays depending on the daily review of the doctors. Because if the patient's starting to develop fever, that could be one of the reasons why they need to remove the arterial line. Kasi sometimes arterial line could last more than a week or 2 weeks, but the tubing itself that is connected to the line should be changed every 4. Sometimes again it depends on the protocols of the hospital. For us, it's every 4. Next is some interesting information that at least you know. You don't really need to know it, but at least you have an idea. First one, that art line, even though it's directly into the artery, we cannot give medication, specifically IV medication, whether it's antibiotic, whether it's an adrenaline, whether if it's paracetamol IV, anything that we normally give in IV infusion or IV medication, we cannot give that in arterial line. Next thing you should know, I mentioned this already, the art line is not accurate, especially if it's inserted far away from the heart. But again, even though it is inserted in the wrist, sometimes the arterial line is not giving a good reading. At least you know, even with that, sometimes we tend to use the normal blood pressure cuff because sometimes we need to compare if the blood pressure from the art line is really accurate. We're gonna compare that to the manual blood pressure and then let's see how it goes, because sometimes there's a big difference on the blood pressure that the art line is showing in real time compared to the blood pressure that we can get from a manual. Yeah, it could happen. So at least you know. One thing that we're trying to prevent, making sure it's properly intact and cannot be easily dislodged. Again, it's connected to an artery. It's not connected in a vein. If it's a vein, there's not much pressure in it. If a normal needle's been taken out from the vein, Yeah, it's gonna bleed, but it will stop eventually. But once an arterial line is been accidentally pulled out, so there's gonna be a blood pulsating outside your body. It's really messy. It does happen accidentally. It's our responsibility as well as a nurse to prevent that. Again, nangyayari pa rin siya. Yeah, at least you know. Next would be, I mentioned this already, the art line could lead to infection. Sometimes, even if you're doing it properly, even if you know that you're cleaning the area first before taking bloods, it could still get infected. Could be because infection coming from other source, maybe the patient already has an infection. So yeah, at least you know. And that's it. That's the brief, easy to digest, a light version of arterial line. Not too in-depth, I would say. Made it simple. Maybe I didn't cover everything, but at least you know what is arterial line. Again, it's the most common procedure. It is the most common medical invasive device that you will see in a patient in ICU. It helps us monitor the blood pressure in real time. We would already see if the patient is deteriorating, if something's happening. It's a great way to monitor them. Yeah, so thank you guys for watching this new series of mine, and I hope that you enjoyed it and you got something from it. Next time I'll think about other stuff that general public doesn't know that we use in ICU or in nursing itself, but again, lighter version or general public version. Thank you so much, and again, my name is Dotson Toys. Don't forget to like, share, subscribe. Don't forget to like, especially because it will help in terms of YouTube algorithm. Thank you so much, guys, and bye-bye.
Pushed on the pedal, move to songs we play together. Feel